Hello, today we're going to discuss needs analysis within rehabilitation. This refers to the systematic process of evaluating an individual's specific needs, abilities, limitations, and goals when designing a rehabilitation program. This analysis is a critical initial step in developing a personalized and effective rehabilitation plan for someone recovering from an injury, surgery, or medical condition. It's really important when you're designing a rehabilitation program that it is personalized, it's linked to the patient and their needs and their requirements. The primary objective of a needs analysis in rehabilitation includes the following factors. The first one is assessment of the individual's condition. This involves gathering detailed information about the individual's injury or medical condition, medical history, surgical procedures if there were any, and the current status of their physical and psychological health. The second one is identifying goals for the individual. We use the SMART process for this. So we establish clear and realistic short-term and long-term goals with the individual. These goals should be aligned with the person's aspirations, such as returning to sport, regaining functional independence, reducing pain, or improving overall quality of life. So functional assessment, evaluating the person's physical function, including range of motion, strength, flexibility, balance, coordination, and proprioception. Functional assessments may also involve analyzing movement patterns and identifying deficits or compensatory strategies, which you can then add into your rehabilitation program. Psychosocial assessment, so it's understanding the individual's psychological and emotional state. And this is crucial. So factors such as fear, anxiety, depression, or stress can significantly impact the rehabilitation process. A psychosocial assessment helps to identify any barriers to progress. And we can work through that rehabilitation program. A lot of athletes, a lot of individuals will have fear and anxiety and depression because they can't do the activities that they want. How can we add in strategies to help them to improve that rehabilitation process? Environmental assessment. So this is assessing the individual's living environment, social support system, and access to rehabilitation resources. This includes evaluating whether the home or workplace environment may need modification to support the rehabilitation process. This is also looking at, do they have gym membership? Do they like swimming? Do they have other commitments such as childcare? Do they work shift patterns? And how can we incorporate this within the rehabilitation program? So previous rehabilitation history. So reviewing any prior rehab experiences, including successes and challenges, to inform the current rehabilitation plan. Understanding what has or hasn't worked in the past can guide decisions making and how we can build this rehabilitation program. For example, your person that you're rehabilitating might not like swimming or hydro, so why would we include that into the rehabilitation program? They might not have access to the gym or they don't like going to the gym. How can we work around that for our patient? We also do a risk assessment. So we identify any potential risk factors or contraindications that may affect the rehabilitation process. This can include considerations related to medication or other health-related factors. Communication is such an important aspect of rehabilitation. So we need to ensure open and clear communication between the rehabilitation team and the patient. All parties involved should have a shared understanding of goals and expectations. The patient should be able to feel open to talk to you about what they like and what they don't like, their worries, their anxieties. Why hasn't there been an improvement this week? So we can adjust the rehabilitation program. A rehabilitation program is a dynamic process, so we always make adjustments to our patient with that as well. So individual preferences, considering the individual's preferences, motivation, and values when designing the rehabilitation program. And this helps tailor the program to the person's unique needs and interests. This will increase the adherence to the rehabilitation program. So if the patient buys in and you work it around their likes and dislikes, the patient will more than likely do the rehabilitation program. So we will then see the results that we would like. Ongoing assessment, recognizing the need that you need to make changes to the individual progress, or the program through rehabilitation. So regular reassessment of the patient and adjustments of the rehabilitation plan are essential to ensure that goals continue to be met effectively. In summary, by conducting a comprehensive needs analysis, people performing rehabilitation can create a personalized and evidence-based rehabilitation program that addresses the individual's specific challenges, it optimizes their recovery, and empowers them to achieve their goals. It also helps establish a strong therapeutic alliance between the individual and the rehabilitation team as well. And this will enhance the overall rehabilitation experience.